Thank you very much. Good afternoon, everyone, and welcome to the second session of our SNP Model of Care approval training today. Again, my name is Brett Kay. I'm the Assistant Vice President for Recognition Operations here at NCQA. In today's session, we'll be focused on the Model of Care elements 3 and 4, and we'll focus on content and requirements related to those. First, I want to thank everyone for attending and thank CMS as well as our partner in this for this training. A couple of quick housekeeping items, and I'm going to turn it over to our colleagues to get into the content. So first, we will be providing opportunity for you to ask questions and have Q&A back and forth throughout the session. If you have questions, please either use the chat function, and you can type the questions in, or when we stop for breaks and pause, you'll be given instructions on how to ask a question over the phone line, and you can go through that way or use the chat function. I want to let you know that we will be posting the slides. Give us about 3 or 4 days or so, and we will post these slides on our SNP MOC website, and the address for that can be found at the end of these slides as well, and we'll post it into the chat so that everyone is able to see that. We'll give the web address for that so that you'll be able to get the slides within a couple of days or so. And then first, I want to just turn it over to Heather Barks or Donna Williamson from CMS, who we are working with, and see if they have anything that they want to offer before we go ahead and get started. Heather or Donna?
Thanks, Brett. Hi, this is Heather. I just wanted to say welcome to everybody, and also, as Brett mentioned, thanking everyone for their attendance. And today we have Donna Williamson and Natalie Albright, and I'd like to thank them both as CMS team members working on the model of care along with NCQA.
Great.
That's it.
Thank you, Heather. And welcome. Thank you guys for participating. And so now I'm going to turn it over to Sandra Jones, who's going to get started with the the content for today's training. Go ahead, take it over, Sandra.
Thank you, Brett. And I'd like to introduce you to the staff working with me on the NCQA side, and that is Linda Uwu-Maroki and Avni Barucha. And thank you both for your assistance today. Next slide, please. So let's talk about the agenda. As Brett said, we're going to go over the objectives. We're going to give a high-level overview, and I'm going to ask your indulgence now. If you were on the training on Tuesday, I am going to repeat some of the reminders that we presented, just in case there are newbies joining us today. So we'll talk about the scoring, what to look for, the project timeline, again, the reminders, and then we'll walk through MOC 3 and 4 examples, provide you with time for Q&A, and Heather will present her review on HPMS and walk you through how you are submitting there. And then we'll talk about what you need on our end to put into HPMS. Okay, at the end, we'll wrap up with information on how to contact us and where your resources are. As Brett said, we'll talk about the SNP approval MOC website, and we'll give you that address. Next slide, please, and go on to the next one. I already said, for those of you in attendance Tuesday, forgive me, but this should not be new to you. The objectives of the Special Needs Plan is for compliance towards the Affordable Care Act. That's so that your model of care must comply with the statutory requirements. We define health care delivery. So, and in reviewing this, we provide oversight for the provision of a robust model of care for all SNPs. Lastly, to review, monitor, and track approvals per the requirements. And most of you know, again, that the requirement cycle is 1 to 3 years. However, there are some exceptions, as we found out on Tuesday, and we'll talk about those later in the slide. Next slide. Okay, so here are the 4 model of care elements, and I may say MOC or MOC, and I want to use that interchangeably. Target population is MOC 1. You need to provide a detailed description of your plan's target population, and this will include your general SNP population as well as those that you describe as your most vulnerable. We're also going to talk about MOC2, which is care coordination. That covers the spectrum from staff structure to beneficiaries, risk and health assessments, risk stratification, care planning, the ICT or interdisciplinary care team, and transitions of care. MOC 3 talks about the provider network. And I want to point one thing out, and that is that this includes practitioners as well as facilities. So please make sure you get that in your description. And last but certainly essential to the success of the plan's operation and processes, MOC 4, which talks about quality measurement. Next slide, please. And again, briefly, if you've been here with us before, your renewal, you know that the highest you can get is a 3-year approval, and that's 85% or above. The 2-year approval is 75 to 84, and the 1 year 70 to 74. You also will be aware that the plan scoring below 70%, that is 69% or below, need to come back through paying attention to those comments that are placed in the HPMS and to what needs to be corrected. When you come back, if you have to come back for the cure, know that there is only a 1-year approval that is given. Now, subject to changes, and that is for C-SNPs, a major change to this process occurred. And again, I'm going to bring that to your attention very shortly. Next slide, please. I think this slide speaks for itself. We talked about it again the other day. Please take a look at it at your convenience. But please note, just in case you have to come back for the cure, we will be hosting a technical assistance call on April 18th. That is prior to the cure submissions that will be due. And we will walk through later today the process for coming back for a cure. But just in case, if you have questions that are technical or questions regarding the comments that was in your results, you can talk with us about those then. Next slide, please. So here's the big change that most of you have been waiting for if you were not here on Tuesday. Next slide. So, as per the HPMS memo and as a result of the Bipartisan Budget Act, that is the BBA of 2018, a modification took place for the requirements for C-SNPs. So beginning with this February submission, that is the approvals for the 2020 cycle, all C-SNPs are required to return annually to address results of plan goals. And the objective there is to determine whether the plan achieved its previous year's goal as documented in your MOC. And you need to detail the action taken if the goals were not met. So basically, it's not the only change is that you have to come back and actually report every year. But these goals are referenced in MOC 4B, and we're going to get to those today. We just mentioned it the other day. But to recap, this change in requirements is applicable to C-SNPs only. Therefore, it does not apply to D-SNPs or I-SNPs. And one important thing to note is that C-SNPs will no longer be allowed to come through with revisions during the off cycle. Any substantive changes must be included in your annual submission. And again, this constitutes a 1-year approval for you. Next slide, please. And I did advise strongly the other day that you review the regulatory language within the elements and the explanations and the scoring guidelines. This gives you some insight into what the surveyors are looking for, above and beyond what you see in the factors. Also, if I can mention, we have some what we call handouts on the screen. Please, we're not going through those in their entirety in the essence of saving time, but I would advise that you take a look at the slides, look at those handouts, look at the cheat sheets, as I call them, at the end of the program today, and just look through them and see what's highlighted that you could have missed. We also recommend that you use it as a checklist. So, pardon me, remember that reviewers are looking for process details and descriptions regarding your plan and beneficiaries. The MOC narrative should be written as a process document that addresses the who, the what, where, how. Your MOC is further based on the guidelines and evaluated as a new submission against the requirements. So we're not looking back at what you wrote before. We want to make sure that you have everything in there that's supposed to be. The regulatory language is emphasized within applicable elements. And lastly, general process statements are not acceptable. I have to mention here that in the past, what we've seen is a trend towards more general statements to cover all of the types of plans in your organization or in your service area. What we want to see is if you're submitting H1, 2, 3, 4, we need for you to be specific to the target population for H1, 2, 3, 4. And again, we'll talk more about that later. The details you provide, again, must be relevant to the specifics and needs of that particular plan and not the expectations for SNPs overall. And if that does occur, I have to warn you that the surveyors are prepared to score down. We don't want to score you down. Can we go to the next slide, please? Additionally, when you prepare your narrative, here's some additional points you might find useful. If you're submitting multiple SNPs that share a common MOC, on the matrix document, up at the top, there are little areas where you fill in your H number. If you have other plans that share some commonalities for this MOC, please go ahead and put those in. That helps us and the reviewer to review for consistency. Okay, so we would appreciate your help there. And this will allow us to group them together during reviews. Each renewal year will be considered a review of a new MOC, and as such, it will receive a new score. Note that if the health plan submits the same MOC, it may not receive the same score as previous. And again, we're taking into consideration any changes or additions or points that we need to emphasize from the MOC scoring guidelines. If the plan is submitting a same or similar MOC as in previous years, then go ahead and, again, put that number, the same as H1, 2, 3, 4, or whatever the H number happens to be. And we will elaborate during the discussion on in the other elements if some of these points are relevant. Okay, I'm going to stop talking for a bit and turn things over to Linda Uwumuroki, who will walk you through the Provider Network MOC3. Linda? Are we having technical difficulties? Earl, are you there?
Yes, I am.
Okay, I'm not. We can't hear Linda. Celia?
They may be muted on their own phone.
Can you hear us now?
Can you turn it up a bit? We can't hear you. And we apologize for this disturbance. Stand by while we straighten this out. Go ahead.
Hello, Delia?
No.
We are not able to hear you.
She's very faint.
What about now?
No, it's still faint.
But better.
Can you hear us now?
No, that it's still very low, Delia. Can you turn up the sound?
Delia, it looks like you have a headset connected. Can you disconnect and put it back in, and then let's see if we can hear you then. Ladies and gentlemen, please stand by. We are currently having technical difficulties. We are working on it.
Why don't I go to MOC 4 while they're working on their technical difficulties? Okay. So, Delia, can we skip to MOC 4? Okay, thank you. Okay, so again, we apologize for the technical difficulties, but sometimes those things cannot be foreseen. So, for MOC 4, we're talking about the quality improvement plan. What do the factors require? A description of your overall QI plan. So, create a quality improvement program plan that sufficiently outlines the elements of your program to determine whether or not the overall MOC structure effectively delivers appropriate services that are unique to your SNP beneficiaries. Okay. What you're showing on screen is the language for the regulatory regulations. We also talk about the data sources used to analyze, evaluate, and report conduct QI projects to effect favorable health outcomes and beneficiary satisfaction. And these must also include the frequency for which you're doing these things. We encourage provider participation in QI initiatives. So we need you to show how LT and management teams, key SNP personnel, and other stakeholders are involved in the process, including their role and decision-making authorities for analyzing the performance, and how your specific goals and outcomes are integrated into your overall performance program. And we need you to determine if, after analysis, if your goals or outcomes are not achieved, to provide us with some information. And again, this is especially important for those C-SNPs, and we'll get more into that when we go into Element 4B. So can we go to the next slide, please? Next slide.
Can you hear us?
Yes, we can hear you.
Perfect. Thank you.
Sorry, we were able to get the room back up and running, but if you want to
Yeah, let me go ahead and continue with 4, and we can go back to Linda. Okay, yes. Next slide. We're at the example slide for factor 2. Okay, thank you. So the factor level example talks about how our fictitious plan, Smart Health, works on improving their organization's ability to deliver high-quality healthcare services. It describes their process for evaluations, the reports they use. It also describes the personnel and departments involved in that analysis. And lastly, it talks about what occurs, the before and after, and the frequency for such reviews. Next slide, please. Okay. This example shows that the SNP must describe how key personnel are involved with the internal quality performance process. This includes their role and decision-making authority for analyzing performance. The SNP detailed its response to the factor, describing the roles of pertinent staff as well as their specific tasks. So again, I don't want to take time and read you everything that they've written here. What I would suggest is that you take a look at some of these things and see the types of information that we're looking for. I also need to mention that these handouts are not all inclusive. In other words, it's not everything that's required from the elements and factors. So just be warned. Next slide, please. So here's the culprit. The intent of MOC 4, Element B, is to define specific measurable goals and health outcomes for the target population. Here, the focus is on health and clinical measures such as controlling diabetes or reducing hospital readmissions, as opposed to the measures focusing on plan operations, and that's the difference between Element A and Element B. Element A is plan operations. Element B is your overall beneficiary results, health outcomes. Okay? Please note that this is also on an organizational level and not member or individual. In other words, I want to emphasize overall. I would like to emphasize that the BBA rules for the C-SNPs is applied here. C-SNPs must assess their previous year's results to report improvements and plans to address missed opportunities and barriers to planned improvements. Next slide, please. So, MOC for Element B. The Factor 1 responses must include but are not limited to your specific goals for improving access and affordability, improvements made in coordination of care and appropriate delivery of services through direct alignment of the HRAT, the ICP, and ICT. We want to see a direct alignment, which would mean that services delivered to SNP beneficiaries are based upon the beneficiary's assessments. We want to see enhanced care transitions across all health care settings and providers for the SNP bennies. Also, ensure that appropriate utilization of services for preventative health and chronic conditions. So that's all in Factor 1. For Factor 2, the stated health outcomes measures, we want to see the organization-specific data sources that you will use. And the MOC should describe the specific measures to meet overall quality goals as detailed in Factor 1, including, and there's parentheses around this, including expected time frames for meeting those goals. In Factor 3, Your MOC must describe the methods the organization uses to assess and track how its overall quality program, including the goals and specific measures, is used to affect the health outcomes of beneficiaries. This may include the data collected, how it's collected and analyzed, and how often it is collected and analyzed. And factor 4, the MOC must describe how it determines if the goals described in factor 1 are met. And factor 5, you must describe in the MOC the actions taken if it's determined that your goals are not met within the specified time frames. Next slide, please. So here again is another handout. In this example, the SNP provided an explanation for its goals and the format for such, the data source collection, evaluation methodology and analysis, and the process for identification of limitations and barriers, as well as the process for implementing those improvements. Next slide, please. In factor 4, the MOC must describe how you determine if the goals described in factor 1 are met. The surveyor is looking for details, for example, a description of the steps in the process. These details must be written so that questions posed are addressed. And I like to borrow a theme from the TV commercial like Ragu. The surveyors want to see that it's in there. Next slide, please. So in factor 5, the organization must describe in the MOC the actions you will take if it is determined that goals are not met within the specified time frames. Again, we are looking for specificity. Next slide, please. So for MOC 4 element C, what we're looking for is for the plan to describe the types of surveys that you use to assess your Benny's member experience. This should also include the rationale for the use of a specific tool and how results are integrated into the overall performance improvement plan. There are numerous ways for plans to measure patient experience, and CMS nor NCQA are not prescriptive in requiring any specific survey instruments. The key here is to provide details on the survey methods and, again, the details on the process. Next slide, please. So as noted in the previous slide, SNPs need to describe the specific tool or tools used to measure patient satisfaction and explain why they use those tools. So that was factor 1 and factor 2. For factor 3, please provide the details for integrating survey results into the overall plan for improvement. Finally, factor 4 requires a description of the steps you will take to address issues identified during the review of the results. Next slide, please. This example shows how the SNP uses member satisfaction data to incorporate results into its QI plan and subsequently implements improvements. Next slide. In this example, the SNP provided the details on how the QI team tracks opportunities it identifies and incorporates those interventions into the work plan. Additionally, it explains how it provides progress reports and updates. Factor 4 also shows, now that you have the results, what will you do with it? The organization must describe its methodology it used to collect and analyze member experience surveys, including the sample size. It must also describe how it receives feedback from a broad sample of members, going beyond those members or caregivers who contact the SNP to share feedback. In other words, not solely looking at complaints and appeals data, as that feedback should include comments on experience with staff or resources used. Next slide, please. For element D, the intent is to describe how the SNP uses the results from elements A through C to improve its MOC overall quality improvement plan. Next slide, please. The SNP must provide a written description of the ongoing performance improvement evaluation of the MOC. This process must describe how the SNP will use the results from its various measurement activities and any indicators described in elements A through C to determine if it's improving on a continual basis. The operative word there is continual. For factor 1, plans should describe the collection and evaluation of quality improvement data, the frequency of collections and analysis, and how it will incorporate the results into improvements of the MOC. For factor 2, the SNP should describe how it incorporates the results of continual assessments to evaluate quality. For example, what worked well and what didn't to ensure ongoing quality performance. The organization's MOC description must also describe how lessons learned are incorporated into the assessment and ongoing improvement efforts. For factor 3, the SNP should describe its ability to incorporate improvements, for example, interpreting and responding to the results of a continual assessment and lessons learned to ensure ongoing quality performance. For factor 4, the description details how your evaluation is documented and shared with key stakeholders, including the process for such sharing. Next slide, please. So this is a lot of information on this slide. Basically, it just shows the detailed description provided for factors 1 and 2. It denotes how the SNP uses continued assessments to evaluate quality. To determine if it's improving on a continual basis, for factor 1, plans should describe the collection and evaluation of quality improvement data, again, the frequency of collection and analysis, and how it will incorporate those results into improvements of the MOC. For factor 2, the SNP should describe how it incorporates the results of continual improvements to evaluate quality. And again, as we said previously, what worked well, what didn't. Next slide, please. For factor 4, the description details how the evaluation is documented and shared with key stakeholders. Who gets it, the frequency of distribution, and how it is sent or received. And keep it here. As previously stated, the intent of element E is to describe how quality performance results are routinely shared with stakeholders and specifies the frequency of these communications and how ad hoc and other unplanned communications are disseminated. Next slide, please. So this is an example of how detailed the description can get. It includes, but is not limited to, there's a list of SNP leadership here. There are personnel and staff that are involved in the analysis and data collection. And there's a list of applicable regulatory agencies who may be the recipients of that data. Please note, again, the example is not all-inclusive. However, it is inclusive of time frames for that report. Okay. I'm not sure if you got ahead of me, or this is the last one. Go to the next one. Yes, that's what I have next. Don't know what that is. Okay, so basically it's just going back over the same information. That this may include a list of pertinent personnel as described in the previous snapshot. And we will pause here for Q&A. Okay, Earl, if you could open the lines for questions. Dave, while he's doing that, once he makes the announcement, if you want to start reading some of the questions we've received.
Ladies and gentlemen, if you would like to ask a question, please use the raised hand feature that's located on the lower right-hand side. We will see your name, and we will announce you and then unmute your line to ask your question. Thank you.
Thanks so much, Earl. Can you guys hear me all right?
Yeah, you are it could probably be a little louder, but we can hear you. It's a lot better.
Okay, I'll just move closer.
Yeah,
that's better. Okay. So the first question is, when was the decision to change the off-cycle MOC submission dates communicated to the plans? And that was asked before we started.
To change the off-cycle dates? The only thing we've changed with regard to the off-cycle, the change for the C-SNPs is applicable. Heather?
This is Heather. We got a question similar in our policy mailbox. I think they're referring to previously the gates closed on January 1st, and this year the gates closed on November 30th, so that we had December was non-off-cycle submission. I believe we just announced it on the HPMS off-cycle website, which is the same thing we did when we closed it the first year.
Thank you, Heather. And the next question was in regard for the C-SNP, what is the scoring for the new one-year process?
The overall scores remain the same. The only difference is that they have to come through, they can only be given a 1-year approval. In other words, the 2-year and 3-year are no longer applicable for C-SNPs because they have to report their the results of their goals.
And my next question, Heather, this is for you and your team. Is there a contact outside of the DPAP mailbox we can send MOC questions specifically related to the off-cycle submissions?
No, there is not.
Sorry, hold on one second. I'm getting caught up.
No, that's no problem. To clarify or elaborate, the DPAP policy mailbox is for all of MA policy questions, and we have people triaging all of those questions. So off-cycle MOC questions will get to the correct subject matter expert to get your questions answered. So that's our contact.
Okay, and this is going to be my last one before we see if anyone raised their hand. Are there any other Balanced Budget Act changes for C-SNPs that must be addressed in the 2020 MOCs?
And I'm going to throw that to Heather.
Sure. So for the 2020 MOCs, they're being to just be crystal clear, the 2020 MOCs are the ones that are coming in for submission on February 14th, 2019, so this year. There are no, long answer short is there are no more CBA implications for 2020. The only thing we are addressing for this year is the C-SNPs and the annual submission for C-SNPs.
Thanks so much.
Okay, Earl, are there any hands raised?
We do. We have about 5 hands raised. And to let you know, if your question has been answered, you can click the raised hand icon again to lower it. We are going to start with Mercedes Howell. Mercedes, I'm unmuting you now.
Thank you for taking our question. We are a new health plan effective 1/1/19. We did receive a 3-year approval on our last MOC. For this MOC submission with the matrix, is it presumed then that we will not have data to present within the MOC on those results of goals and objectives because we only have 1 month of data by the time the MOC is submitted for 2020.
To clarify, you're a C-SNP?
Yes, we have 2 C-SNPs.
Okay, yes. Then for those C-SNPs, that's what you would input that information in the correct boxes. And Sandra, I'll let you elaborate on that.
Okay.
But I mean, overall, yes. Go ahead.
I was going to tell you, I did not hear the last part of your statement.
So her question is, we're a brand new C-SNP, 2 new C-SNPs for 1/1/19, so they turned in their MOC last year and got a 3-year approval, but they only have data for 1 month because they've only been in operation for 1 month, and because of the BBA changes, they have to come in again this year as a C-SNP, and so they want to know what information they should put in the goals and the data met progress section because they only have 1 month worth of data. Okay,
so basically what Heather just said, I would put a comment in there that says your SNP was just approved for operations as of January 1 of this year, and there is no data available to report, and that's the long and the short of it.
Yeah, and this is Brett. Just to add to that, I think what would make sense is to probably continue for this submission to use the data or to use the goals that you originally intended to use previously, because there isn't data currently. It's almost as if you're brand new in that sense. But just to clarify for folks on it, if you are a chronic SNP, chronic SNPs only have to come back year after year. If you have dual eligible or institutional SNPs that have 2 or 3 year approvals, they do not have to come back on an annual basis. Just wanted to be, because I wasn't sure if she said C-SNP or D. As in
no, she said C, chronic.
Okay.
Okay, thanks, Brett.
Okay, the next question will be from Sushana Yu. Sushana, I'm unmuting you now.
Hi, thank you. I know you had stated that the slides will be available next week, but we were wondering if it was possible to please show slide 46 again. We were just taking notes on it and we were unable to finish.
Slide 46 is up now.
Thank you so much.
Okay, the next question will be from Cindy Johnson. Cindy, I'm unmuting you now.
Good afternoon. Thank you for taking my call. You mentioned that on the MOC goals that they should be yearly goals. If we have a 3-year approval for our D-SNPs, are you saying we should have differing goals every year? What if we didn't meet them? Could we continue them?
Okay, we did not say, or if it was implied, we did not say that you had to have new goals every year. You have to come back through your reporting on any progress on whether the objectives of that plan were met or not met. Who we were talking to was the chronic SNPs. They have to come back every year. They have to report the results.
Thank you for that clarification.
You're quite welcome.
Okay, our next question will be from Kelly Dotson. Kelly, I'm unmuting you now.
Thank you. And my question goes along with the last one. So am I understanding that for the C-SNPs, you want to see the actual results of the goals that are in the model of care? And then from there, if we change the goals or what we do based on whether those goals were met or not, you're actually wanting to see the data and the results from the goals.
Okay, so you've got your goals. They're written. And similar to the reporting that was previously in the model of care requirements, you need to report on whether the goals were met because you have the benchmarks there. So the difference is if those goals were met and you can see it going, maybe referring back to the benchmarks, And if they were not met, we want to know your actions that you've taken to address that. If they are met, are you keeping the goals? Are you making some changes to make the goals more challenging? Does that clarify your question?
Yeah, that helps. So in the others, previously we've described what we do when the goals are met or not met. But in the C-SNPs, we need to actually say whether they were or were not met. So that's
correct.
Okay, thank you.
All right, our next question will be from Tricia Norris. Tricia, I'm unmuting you now.
Thank you, and I'm going to stay on these C-SNP goals because I don't know if anyone else is feeling the same way I am, but that's the first we've heard of anything about reporting results of our goals in our model of care. And I've got several questions on that, but the first one is, does that apply to this year? Because that's not the path that I think any of us were going down when we had said we had to refile the model of care every year. It was being refiled as we always have. And I've got other questions, so don't mute me.
Okay. Let me just say that this is when you heard me give an update about each model of care will be reviewed on what's presented. So if things have changed, any revisions or additions to information, those kinds of things should be in there. So the point I'm trying to make is I do understand that this information was recently shared, but this is the forum for us elaborating on what the requirements are for you to update your model of care for this year's submission. So unfortunately, yes, this year you will have to go back and take a look at those goals, the those benchmarks, for the necessary reporting on what the status is.
Okay, so I'm sorry. So can you still hear me?
Yes.
So is it saying that we're leaving the benchmarks as they are, or the actual results? Because most of the results of the goals is based on claim data, which there's a lag, so the results are not even ready at this time of the year to report on the previous year. So that's why this is kind of critical in what the expectation is to see in these model of cares that we're pulling and preparing, like the guidelines say, for submission in a very short period of time.
Okay. I'm going to say one thing, and then I'm going to ask Heather to put in her 2 cents. But I'm thinking that you are collecting information or data throughout the year. So if you only have information up through the third quarter or something like that, that's the information that you will use to assess whether or not you have you are on target to meet the requirements or the goals, or if you're going to need some adjustments to be made. But I would think that you're not saying you don't have any data at all with which to update your MOC. And again, I'm going to ask Heather to weigh in from CMS's standpoint.
Thanks, Sandra. Yes, I agree. So with the new CSIP stuff, we are already expecting you to say what you do when you don't meet your goal. As someone has previously pointed out, that having a goal or having a quality program is not new. And so we have been expecting plans to be keeping, tabs on their results and monitoring their quality program, which is why we have in the MOC tell us what you do when your goals are not met, or tell us what you do when your goals are met. And so the only change here is you're just sharing the results with us. We did not expect it to be a large burden, assuming you all were calculating your own results. Understanding, though, however, that there is a lag in data and all of that, and that's okay. You can just simply explain that in the MOC itself, just like the question before. If you don't have data because you're a new MOC, just explain that. The data that you are sharing of here's our results, go ahead and just, that's okay. But whatever data you have available that you have been keeping with your quality program, that's a part of your MOC requirement, which is a requirement to be a special needs plan, just share that with us now in the MOC.
Thanks, Heather.
Sure, no problem.
Are we clear on that, the response to that question, or do you have another follow-up?
I guess I'm just speechless. So you're not wanting the entire, you're just wanting something that says basically a status to the goals, because yes, we monitor them all year, but we're not, there's no requirement to have them in a particular type of format or anything like that. So I'm just trying to make sure we do what you want, because this is new. And
right.
For those of us that have a lot of C-SNPs, this is kind of overwhelming, finding it out now when we got to file, in a very short period of time. So that's why I'm just sticking to this, and I'll let it go with that.
Okay. And let me just add to close that remember that the model of care is a narrative. So we're not looking for any in-depth Excel spreadsheet or anything like that. Basically, we're looking for a narrative, whether or not you have met your goals, you're on target for meeting the goals, or some adjustments have to be made. So basically, if you kind of answer those questions, you'll be meeting the requirements.
That's exactly right, Sandra. I appreciate you saying that. We don't want to overwhelm anybody. We do completely understand and appreciate the late notice on the C-SNP change and the BVA itself. But we want to reiterate that we just want to know where you are in your goals. It's part of the statute, frankly. The BVA tells us that we all need to do this. And so we're not expecting any major data collection with an Excel spreadsheet or analysis or macros or, nothing crazy. It's just a check-in. If you have annually having goals set or quality improvement plans as you are required under the SNP, now we just want annually a status check on how that quality is going and what your results are. But we're not asking for specific, it has to be, this result or that result. And much of that, like Sandra said, is the same with all the other elements in the MOC, is we try not to be super prescriptive. We don't want to give you, this is exactly how it has to be done, because especially with C-SNP, every plan is different and every target population is different. And so you guys are on the ground, you're working directly with your beneficiaries, and we want to make sure that you're able to provide the best care possible and keeping the quality up. And we also want to make sure that that's happening while also being in compliance with CMS Regulation.
Okay.
Hey, Heather and Sandra, it's Donna Williamson. I just want to add additionally to what Sandra and Heather have provided is that we understand this is a new requirement, and just please do the best that you can to evaluate and provide some results using the data that you have, and also know that this is a learning curve, so we'll take a look at this, and then next year we will likely have some additional guidance and to be able to refine that. So again, just like Heather said, we don't want to overburden people, but just do the best you can, and I'm sure we'll have some additional guidance for next year. Thank you.
Thanks, Donna. Okay, let's table any additional questions for now so that we can get through the next two sections. We're going to go back to MOC 3, and then we're going to go, and Heather will walk through the HPMS review again. Linda?
Can you all hear me?
Yes, we can hear you.
Okay, good. I had a nervous breakdown. I was like, okay. All right, so thank you, Sandra. Good afternoon, everyone. I do apologize for the earlier technical difficulties, so we do appreciate your patience. So if you were with us on Tuesday, welcome back. If not, I'd like to reintroduce myself. My name is Linda Uwumarogi, and I am with NCQA. So for today's session, I'll be reviewing MOC 3, Elements A, B, and C, and it all falls under the topic of the provider network. And then afterwards, we'll open up the phone lines again to allow for some questions and comments. Next slide, please. So to start, we'll review Element A, and in our previous training session, we stressed the importance of clearly defining your SNP target population because it would provide the foundation for all of the other MOC standards. The intent behind this element is to answer the question, who serves the target population? So the expectation for plans is to provide insight into the provider network that is involved in the management of the SNP beneficiaries. So to meet this intent, you really want to be sure that you include your overall network composition and highlight your oversight process as well. Next slide, please. So although I'm not going to go into great detail here, I just want to let you know, please be sure to review all of the staff level details. But in summary, I will say that you'll need to identify the types of clinical expertise available, both in the delivery and the coordination of care. And you'll also want to speak to the process for tracking active licenses, as well as keeping the provider information up to date. Next slide. Now I'd like to review a sample response to Element A, Factor 1. This factor requires a description of the specialized network. So in this case, we're taking a look at that suspicious plan, the Smart Health Plan. They've presented to us a chronic condition SNP. They've identified that they have a network of endocrinologists, cardiologists, and mental health specialists, which are all clinically relevant providers servicing their type of targeted SNP membership. So, and they've also made mention of the facilities in which members can receive care. So they talk about a dialysis center as well as a rehabilitation facility. So there also might be a need for you to include providers considered ad hoc. So they're only really used under special situations. You'll want to be sure that your MOC discusses those procedures for those scenarios as well. You can go to the next slide. So we want to highlight the importance of providing the best type of care for the SNP beneficiaries. So more than likely, this is going to involve the collaboration between the member as well as their providers. Overall, we notice, you guys may notice, that healthcare is moving towards a more person-centered approach to care. And we found that an interdisciplinary care team, or an ICT, is really essential in servicing members, particularly those with special needs. So in this example, the Smart Health Plan, they're describing their ICT. The member remains at the center, while the PCP is acting as the clinical driver for all of the clinical care. And they're collaborating with the care manager, who then connects the member to different needed services. So the takeaway from here is that the MOC should thoroughly explain how the providers in the SNP network, 1, communicate with each other, 2, how that communication is updated regularly, and also how it's incorporated into the individualized care plan, ICP, for the SNP member as well. We can go to the next slide. And this slide is simply the reference code of regulations that requires the SNPs to have clinical expertise within their SNP network. So we can go to the next slide as well. Next, we're going to move into MOC 3, Element B. And here the requirement is for the use of evidence-based care and services. So as a SNP, you're going to need to demonstrate the application of clinical practice guidelines, or CPGs, and care transition protocols, CTPs. So the intent here is for the MOC to really describe how the plan ensures beneficiaries are receiving appropriate evidence-based care and services. We are going to ask that you explain and also identify which guidelines should or should not be used for the target population, and also highlight for us the oversight process for these protocols, the who, the what, and the how. You can go to the next slide. Thank you. So there are 4 factors outlined in this element. I'm going to encourage you to dive deeper into the specifics here. But I will emphasize that there are several parts to meeting the requirements. So you'll need to explain how the providers are appropriately using those CPGs. You'll also need to have to give us an account of the monitoring process, how that occurs, how modifications are made, how the providers are maintaining the continuity of care transition protocols and making use of those appropriately. Go to the next slide. So in this slide, we're looking at another example of a response, and this is for Factor 2. So this factor requests details on how certain CPGs are going to be utilized based on the needs of the member. there are going to be instances when a certain CPG is just not appropriate for the beneficiaries, especially those with complex healthcare needs. In that case, you'll need to address those challenges and identify individuals involved in making decisions on whether or not they're going to modify them or ignore them. Next slide, please. This next example is reviewing the plan's documentation for Factor 4. And Factor 4, we're describing the transition protocols, which assist in the transition from members to one setting to another. So the MOC should address any challenges that are faced, as well as how your SNP oversees the network providers to ensure that they're following the required protocols as well. Next slide. Again, this is another reference slide for you. It's the CFR regulation requiring SNPs to use those CPGs and CTPs. Next slide, please. And the final element for MOC3, which is, MOC3, element C, this is the requirement for the provider network training on the model of care. We want to know how your SNP trains your provider network. The trainings obviously should occur initially when the provider is included, and then annually thereafter. We want to know how they occur, how it's tracked, and what actions you're taking when the training is incomplete. And go to the next slide, please. So again, we have 4 factors for element C, which need to be fully addressed. It's essential here that you include your in-network and out-of-network providers servicing your SNP members. As far as evidence of training goes, that can be presented in various ways. You can provide us with screenshots, PowerPoint slides, training plans. Just remember that the MOC training is a requirement for all the providers that see your SNP beneficiary. That's the takeaway from this. Let's move to the next slide, please. So element C, factor 2, reviews the plan's evidence of training. And in this example, Smart Health plan, they've described their orientation. And at their orientation, the providers receive training documents. They also use a sign-in sheet and have attestations to capture the attendance. Please understand that an example of training is required. So if you see or you want to use just a heading or a paragraph simply stating that training occurs without any evidence, that's not going to meet the requirement. We'd like to see some documentation, something dated, attendee list, maybe a couple screenshots of a web-based training or attestations. The MOC must speak to how the training is available to the providers who are receiving their initial training, and then also how they can reference back to those training materials as well. Next slide, please. Factor 4 requests details on the SNP process for handling incomplete training statuses. So this sample response actually identifies the challenges which hinder their providers from attending training. So sometimes those physicians are just simply hard to get a hold of. Maybe they have, time limitations or staffing resources that are limiting. So if you have similar challenges, right here, this would be a great section for you to highlight them. And we want to know how your SNP intends on handling that type of participation. So for instance, if they aren't able to make your in-person training, do you offer a web-based alternative? Things like that. So those type of action plans should also be mentioned here. You can go to the next slide. So we're looking at another CFR regulation reference. This one is the reference for requiring SNPs to hold the MOC training for the network providers. You can go to the next slide. This actually concludes the review of MOC 3 on the provider network section for today's training. At this time, I'd like to open up the floor to any questions that you might have on this section.
Ladies and gentlemen, once again, if you do have a question that you would like to ask, please use the raise your hand icon. If you feel that your question has been answered, please press on it again and it will lower your hand.
Delia, do we have questions in the chat? I've answered several.
I see that. There's just one that has come through since Linda was speaking, and that is, in the past, for provider training, you looked for example slides or detailed outlines for the MOC. Is it now required to include dated provider attestations / evidence of training actually having had occurred in the MOC?
Basically, what we're looking for is that detail. Again, the specificity, describing the process, the content of the slides. I need more than provider training. We're going to talk about provider training, or we're going to talk about the MOC. We need a description of what that content includes. So the short answer is no, we don't need. You just would put that in your process that a dated, signed attestation is received as proof of attending training. Okay, Earl?
Yes, I have a question from Mary O'Hara. Mary, I'm unmuting you now.
I'm sorry, I thought I unmuted took my hand down. My question was answered. Thank you.
Okay, thank you, Mary.
And there are no other raised hands at this time.
Okay. Well, in the essence of time, we're going to turn it over to Heather. And after Heather, we will let you speak to our next reviewer or presenter. And without further ado, Heather. And I apologize, Heather, for not noticing that I had not put your new name down.
I didn't even notice, so it's okay. I didn't even know until Tuesday, and I was like, wait a minute, that's my old name. But so yes. No problem. Thanks, Sandra. Hi, everybody. We'll be doing a quick review of the HPMS module page just so we can get everybody familiarized with what it will look like to physically upload your mock matrix come time. So if we could go to the first slide on this. This is a screenshot of the HPMS homepage. You will see that on the top left under Contract Management tab, the second bullet down says Model of Care. That is the entrance way into the Model of Care module within HPMS. So you would just click on Model of Care. Next slide. And here we have the Model of Care homepage within HPMS. You'll see that we have the off-cycle submission, the renewal submission, and reports. The off-cycle submission is, as someone pointed out, the gates are currently closed for that to accommodate the renewal cycle. Those gates will open back up in June. What is pertinent here is the renewal submission section, the third row down here. You can get your submission history if you need it for any reason or for record keeping, or if you're after you have uploaded and for some reason you're afraid that there was an error and it didn't get submitted, you could check submission history, and that's where you would find that out. So now let's get to the real task at hand, which is how do you upload your mock submission. So you would click upload, and then this is the screen you will see. You will select your contract here on the bottom left. Only the contracts that you have access to will appear. Once you do that, the different mocks will come up under the select a mock piece on the right. Those are all the mocks or SNP types that are corresponding with the contract you clicked on the left. Next slide. Okay, great. So this is just after you click on the mock type, you would hit, you will see that underneath of those two boxes appears a select a mock file for upload. Here's where you will actually go in and upload the mock. So you'll hit browse. You will choose your file, your zip file that has your mock in the mock matrix. So remember, there's both documents are required. And then hit next. So go ahead and do the next slide. Great. And then so once you've done that, this is your renewal submission upload confirmation. Please keep in mind this does not mean that your upload is complete. Once you're on this page, just confirm everything is what you want it to be. You will confirm that the file that you meant to upload is actually uploaded. It happens every year, especially people who have so many mocks at one time. They can get mixed up and the wrong plan gets uploaded under the wrong contract number. So here we advise everybody to carefully confirm that the corresponding correct mock is uploaded for the corresponding contract number. Then you'll have to attest that everything is true, and then you will hit submit. Your mock is not uploaded and not saved, and we will not consider it a submission until you hit the submit button, and then HPMS will officially document it. So once you hit submit, next slide, and then you will see your submission history here. And as I mentioned, you can go into the submission history on the Model of Care homepage, and that way you can confirm and verify once you've uploaded all of your mocks that everything you needed to upload is there and ready for CMS to review. That's it, I think, right? Next slide. Oh, yes. Okay, so that is it, but we have an extra slide here to show you the detailed report. So also on the homepage, the third category was a mock detailed report. If you click on that, it'll go to a page similar to your upload where you'll have to click on the contract that you want and then the corresponding mock or SNP type with that contract. Once you do that, you'll be able to view your mock in detail here. This will show you all of the elements, the narrative that you place for those elements, as well as the scores. This will appear and be available once the scores are available, which we will announce with all of your HPMS notifications after you've gotten submissions on whether or not you've been approved or if there needs to be a cure. All of this will be available. And that is it for me in the HPMS review. I guess before I go, I will say, I know I say this every time, but I would advise now to make sure that all of your plan's contact information is correct and that everyone uploading a mock on your staff has HPMS access and is able to get into the mock module. It's better to test and just verify people have access and you can get in now and everything's functioning. So then the day of or the day before the deadline and things are crowded in the HPMS help desk wait is usually a little longer. Thank you.
Thanks, Heather. And at this point, next slide. I'm going to go on, move forward with Avni's portion of how you submit your MOC into HPMS, what you need to submit, I should say. Avni?
Thank you, Sandra. Good afternoon, everyone. My name is Avni Barucha, and I will be going over the instructions again for the initial and cure submissions. Next slide. So the initial submissions are due on February 13th through HPMS. You must submit 2 different documents, the Model of Care narrative and the matrix. And we do need both of these documents, not just one without the other. So please make sure that you upload both of them into HPMS. We also wanted to point out that any other documents outside of the Model of Care are not going to be accepted, but you can include supporting documentation at the end of your Model of Care as an appendix. Additionally, if you are going to be bookmarking or embedding links within your documentation, please double check that these links are functioning properly. If the survey team is unable to open links, then you will be scored low for that particular element, so please make sure to test out the links before submitting. Next slide. So now I'll be talking about technical assistance for the plans that are coming back for the cure. The cure, again, is only for plans that scored below 70% on their initial submission. Plans coming in for the cure must resubmit both the Model of Care narrative and the matrix back into HPMS in red line changes, which does not mean tracked changes. You must strike out text that is no longer applicable and replace it with new text in red colored font. Plans coming back for the cure must address all factors that were marked down and should resubmit both the Model of Care narrative and the matrix by the date and time that was provided earlier. And just as a reminder again, please make sure that you are referencing any appendices and that you are double checking that the links within your documentation are functioning properly. Next slide. And now I'm going to hand it back over to Sandra to provide a quick recap. Sandra?
Thank you so much, Agni. So, again, I'm going to be mindful of the time, but in the beginning, if you remember that we talked about the handouts, those were the examples that you saw within the slide deck, and these I refer to as our cheat sheets. Basically, it is a brief synopsis or overview, high-level overview of what you need and what you should not forget. Okay, so Delia just sort of page through these. Again, I encourage you to look at these for quick reference as you're going through the elements and go all the way to the end to the training. Because I do want to make sure you don't have any additional questions or things that we can get to. Okay, and then, so we were done with the trainings. The only thing I would remind you about is the technical assistance call. If you score under 70%, that is on April 18th from 3 to 4 p.m. I also want to remind you that we will work to get both sets of slides up, which will be inclusive of the quote-unquote handouts and cheat sheets on this website, www.snipmoc.org. Next slide, Delia. Okay, if you need to get in touch with someone, this is where that information lives. And the links should be live, even in the slides. You should be able to just click on them and get to an email, which will be then sent to the appropriate box. And again, the website for the SNP model of care, again, those resources are under general resources, I do believe. Trainings, recordings, the slides, the scoring guideline, all of those things will be uploaded and be available for your convenience. At this time, we've got a little less than 13 minutes or so. So, Earl, if you could open the lines one more time for questions, please.
Ladies and gentlemen, if you do have a question and you have a phone icon next to your name, please use the raise hand icon, which is in the lower right. We do have one question, Deborah Corbett. Deborah, I'm unmuting you now.
Hi, can you hear me?
Yes, Deborah, we can hear you.
Great. Just a technical question. Are there font and margin requirements, and is there a maximum length of the overall model of care document for DSNP?
I'm so happy you asked that question. We don't want a dissertation. So basically, let's just say the average, and this is not prescriptive or by CMS or NCQA, the average document is between 100 and 200 pages, or maybe even go average 150 and 200. Okay. The font, no, something that's legible. Now, we don't want you to do it in a size 8 font and squeeze it all into 100 pages. And I hope you took that as a joke. Okay?
Great. And do you require like a 1-inch margin all the way around, or do you have a preference?
We don't get that particular.
Okay.
I mean, I would say your typical margin, your typical font, and naturally, you don't want to see it in italics or cursive font, something that's easy to read, because we are reading a lot of these. So, and that's not even in the requirements. So, a business document.
Okay, great. Thanks so much.
You're welcome.
Okay, we have a question from Connie Snyder. Connie, I'm unmuting you now.
Thank you. We appreciate this training so very, very much. It is extremely valuable, and we listen and take notes and try to
complete everything just the way that you would like it. My request, respectfully, to CMS and NCQA is that this is very late. We have 9 business days, but annually the training is late, even when there aren't such significant changes. I wonder if CMS and NCQA could consider holding these trainings earlier. We start writing in November, December, and we have a lot of SNPs. It's very challenging. So that's simply a polite request that maybe you could consider doing these trainings earlier in the year, so we're not scrambling so hard at the end to when we hear the training and learn of things maybe that we now need to change.
Thank you so much for that comment, and we will absolutely take that under consideration as we move forward in the coming years, next year, the year after, all of that. We do recognize that this is sort of between the submission deadline and the training. It doesn't leave you all a lot of time to account for changes. But since we are talking about changes, I am afraid that we had some confusion earlier in our first Q&A session, and I want to reiterate, the only changes for 2020 are that C-SNPs need to come in annually, and that C-SNPs are no longer going to be able to submit an off-cycle submission. Those are literally the only 2 changes that we are asking for 2020. When it comes to the quality section that we went over and your QI programs and the results, we're not asking for anything more than what the requirements were last year. We haven't changed any requirements for C-SNP in terms of scoring, which we reiterated in our memo back in November, that the only changes that were to be coming forth for this year was that they need to be collected annually, and that the benchmark piece and all of that will be coming later through rulemaking. And so we do want you to, as Sandra said, use a narrative. It is a requirement in the regulations that plans all have a QI improvement program, and it's a MOC requirement and a SNP requirement that MOC be approved by NCQA, that there's a quality piece and that piece is addressed. What we wanted to reiterate for C-SNPs is because they are coming in annually and because of what the BBA does say this year, we're requesting that you give us some feedback on those results. But that's not any different than what the scoring matrix for that section said last year, and we won't be scoring anybody differently. With that being said, we're not holding anybody accountable of, oh, we didn't meet our goal. We will not score you down because you didn't meet your goal, and will not give you a higher score because you did meet your goal. It's simply a narrative of explaining to us what your quality improvement program is and a check-in on what the status is as you're going forward. So I hope that I was able to clarify with that, and I just really want to be clear. And as Donna said, we don't want to be overly burdensome. We recognize that even November to announce the annual C-SNPs was, kind of late in the game, and that you do all have changes and that we will all have to accommodate and work with this year. But the only 2 changes, again, are C-SNPs have to come in annually, regardless of how they were approved previously. Even if you had a 3-year approval last year as a C-SNP, you will have to come in again this year. And we will not be accepting off-cycle submissions for C-SNPs. So those are the 2 major changes. And I think that's it, but let's, we have 6 more minutes, so let's get as many questions in as we can. Thank you. Okay. Thanks, Earl and Sandra.
Earl, before you go on, let me answer one thing because I think this is very important. And the question is, are plans expected to submit a redlined MOC annually or only with substantial changes? You are expected to submit a redlined MOC if you come back through the cure and if it is off-cycle time and you are submitting a revision. Okay, Earl? Next question.
Okay. Thank you, Sandra. This is Tricia Norris. Tricia, I am unmuting you now.
Thank you, and I appreciate the chance to ask this question again, and I'm going to go back to the results. We've never reported actual results in MOC4 in all the years that we've been submitting them. So I just want to make sure that on what you're expecting, because we don't want to do something and not get scored for this, critical element. if you're really truly expecting what's been in the past, which has just been how we do things and that we monitor that we have our goals and benchmarks and everything, not what we would put in our monitoring for other type of our internal committee and things like that. So can you please clarify, because it is different. I mean, I don't know where the discrepancy is, but it's different than what we've ever heard before and what we've ever done with that particular section that you just went over today for the very first time.
Sure. Can you clarify what is different?
There was
what you heard that was different. Like
what I'm hearing
the matrix stuff,
is,
or what you're hearing.
No, what I'm hearing, and I think what several people have questioned, is the actual results of our
Correct.
program and goals,
Got it.
not just what we do and our benchmarks and how we monitor and what we do if we have a deficiency and how we do action plans and all of the stuff that we've always put in there. But there was the statement today, not even the other day, but today, that you're expecting to see actual results of our goals.
So, yes, and that's why I wanted to clarify. The requirements have not changed from last year. So I apologize for the confusion or any misstatement today, but the requirements have not changed. We do want to see something about results if that's possible. We understand that the data might not be available, but nothing has changed with the requirements. So there's no specific, you have to have your actual results. If you were not previously providing us with those specific results or specific data, the requirement is the same. There have been no changes to that requirement from last year to this year. The scoring criteria on that element is not changed. That doesn't sound like, I'm not getting a feeling you are clear. Is that helpful?
Yes, that tells us that nothing has changed and that if there's no results in there, like we were previously told to do, that we're not going to be scored down. Is that an accurate statement?
Correct.
Okay. Assuming that changes are coming, and we're probably got a preview of what are coming, but right now for this submission, we do not have to put results in MOC4 about our goals.
Absolutely, correct. Thank you very much.
Okay,
that's
thank
exactly
you.
Right. Yep.
Okay, there are no other raised hands at this time.
Thanks so much, Earl. This is Delia. I just want to reiterate real quick for the website. It's actually www.snipmoc.ncqa.org. We will update this slide to show the correct prior to submitting. And as we mentioned earlier, everything will be up on the website, the slides and the recordings, about a week from today's training.
Thank you, Delia. Heather, Donna, Brett, unless there's something that you'd like to add at the end to wrap up, we are at 4:29. Last chance. Any last words?
No, I do want to say thank you again for hanging in there with us Tuesday and also today. And I want to apologize again for any confusion we caused with the results issue. And otherwise, thank you very much, and we're looking forward to your mock submissions.
Thank you, Earl. Brett, anything? No?
No, nothing from my end either. Thank you again. Just want to thank everyone and thank our team and thank CMS for participating and answering everyone's questions. And thank you all for attending. We look forward to your MOC submissions in February.
Okay. And if the team would hold on after the closing for a minute. Earl, you may now end the program.
All right. Thank you, Sandra. Ladies and gentlemen, thank you for attending today's webinar. This concludes today's presentation. You may now disconnect your lines and have a nice day.